Great. Yeah, we're gonna pass this on obviously to Claire, because Claire's going to co-chair this one, and I think I'm going to be loitering in the background doing some Slido polls and trying to make the tech work, which will probably be a fail, but I'll give it a go anyway.
Hi everyone, I'm Claire Gleeson. So I work for Keyring. We're a charity and a provider organisation. We work across 27 local authorities across England and Wales. And since 1990, we've been supporting people to live in their own homes and creating networks of support that are rooted in communities. So being here today feels quite apt, really. I'll pass on to Stefan.
Thank you, everyone. Good morning. So I'm Stefan. I work for CQC as one of the senior specialists for people with a learning disability and autistic people. And I'm here because I had a chat with Chris, who told me about your group. So I'm here today to listen to you and learn from you. And I'll pass over to Victoria.
Thanks, Stefan. I'm Victoria Caruana, so I'm working with the Royal Borough of Greenwich at the moment. I'm leading on the market shaping and market development work. And part of that is obviously including the ISF development. And I will pass on to Kate Garner, please.
Thanks, Victoria. Good morning, everyone. I'm Kate Garner, and I'm currently working with Bournemouth, Christchurch and Poole Council, developing a personalisation programme, which also includes ISFs and some other good things. And I'll pass over, put my glasses back on, I'll pass over to Zoe.
Finally made it. We was trying to join on Google Meet and not Teams, so we're here now. So I'm Zoe Titchener. I'm a commissioning officer with Nottingham City Council. Currently reviewing our extra care provision as well as our day services. And I'll pass over to Amy Groom.
Hi, I'm Amy Groom. I'm a commissioning officer at Nottingham City Council, and we're coming to look at our home care model soon, so I'll getting involved with that. And I'll pass over to Anna.
Hi, I'm Anna Coltman. I'm also a commissioner at Nottingham City Council, working on the review of our extra care services, and recently been working on our market position statement. Is there anyone else that hasn't been? Because I joined late.
Fiona, I think we've not heard from Fiona yet.
Hi, I'm Fiona from Plymouth City Council. I commission services and support for people, and yeah, looking to see what's happening and how we can change things in Plymouth. Thank you.
Mary.
Victoria.
Oh, we've had Victoria. Got Mary.
Hi everyone, I'm Mary. I'm from Sheffield City Council. I'm leading on an improvement programme around personalisation and direct payments, and we're really keen to move along with our individual service funds and our generic offer around everything community based and people directing their own support. So I'm really interested just to gain a network of other like-minded people and to try and do things better here. David.
Good morning, everyone. Dave Drayton-Green. I'm the Direct Payment Service Manager for Wolverhampton City Council. I've been to all sorts of meetings that Chris organises, and he seems to invite me to everything and anything that he arranges. They're always really, really good, always really worth attending. I suppose from Wolverhampton perspective, we've done a lot of work around direct payments, personal health budgets and individual service funds. So I guess Chris seems to think I'm fairly useful sometimes. Thank you.
Karen.
Hi, I'm Karen Kirkpatrick. I'm also from Keyring. Claire's given a great account of what Keyring's about, and I think the only thing I can add is it was good to hear, Simon, about the membership, the people joining from South Korea, and we've had a couple of visits from people to South Korea, meeting members and finding out a bit about Keyring. So it's lovely to see how things move on and progress.
Adam. Adam still with us?
think he had to go and take a call,
Oh,
Claire.
you gone? Okay.
Yeah.
So that's Adam Grazy from North Yorkshire. Adam, yeah. So that's the round of introduction, and I guess just to add a little bit further, was just to explain why Keyring is here and supporting the network. As Chris said, yeah, I'm supporting Simon as the co-chair because Keyring are a sponsor of the self-directed support network. And so through my work as the personalisation lead at Keyring, I'm a member of the self-directed support provider network, which has been meeting for the last couple of years. I know there's a commissioner network as well, and hopefully you feel the same as I do about the provider network, that it's a really great forum to connect with the work that Self-Directed Futures are doing, other providers, or for yourselves, commissioners. So work that people are doing around personalisation and using that space to really share ideas and best practice and skills and resources, all of which can enable change. So when Chris asked Keyring if we'd like to support this network, it was an easy decision, really. It was an obvious yes. We did. So hopefully we can bring some insight to the group, as Keyring's had 33 years of experience of creating networks that are rooted in neighbourhoods, whereby the network model recognises that connection and skill sharing and having a community of support is a really key to building independence of people. And likewise, I think as Keyring as an organisation, we know that as connection and skill sharing and communities of support are really key to building our future and supporting a social care system that demands more for people's lives. So I think even after all this time, Keyring are still considered as working innovatively, but what we do isn't rocket science, but the idea of the membership model that often challenges the thinking of local authorities, especially if there's a focus there on time and task. So I think in terms of like being here today in this kind of network about looking at innovative models of neighbourhood care, I think it's a really great opportunity for us all to share what works and what doesn't, and hear about new and different approaches, whether that's locally and as Simon was talking, nationally and globally. And just using this time as well to maybe challenge each other to think differently. So being part of this forum and network for Keyring feels absolutely the right place for us to be and support. So thanks for inviting us, Chris and Simon. So I'll hand over to Simon because he's going to tell you a little bit about the history and the origins of neighbourhood care before we go into some group discussions. So it will be quite interactive after that bit. So over to you, Simon.
Okay. Thank you. So I'm dreaded slides, but I've got all these slides, so I feel like I need to share them. I do have a friend who tells me just talk, Simon, just talk. But I think today I am going to use my slides. So can everybody see that? Yeah.
Yeah.
And just on what Claire was saying, interestingly, I was chatting to two academics locally in Sheffield who are studying ISFs at the moment, and they were singing the praises of Keyring. And we had a conversation about the use of ISFs as a mechanism to drive forward neighbourhood care. And they didn't realise how old Keyring was really, or I was saying how I remember when Carl Pohl created Keyring and how inspiring it was. But in many respects, it was an innovative model that was really innovative for the now, for the future that's emerging now. It's amazing, and the testimony to the work that Karen and Claire and colleagues have done, that Keyring has actually survived and flourished in a kind of commissioning environment, which is often hostile to the kind of basic principles that I think Keyring are about, which are very innovative but common sense as well, as Claire says. And that is a good example of what I want to talk about. And Claire and Chris have kind of given me half an hour. I'll try and keep it easily underneath that. So I think we're at a kind of interesting point of change. And so this is the first event of this kind of commissioning group exploring innovative models of neighbourhood care, the first for SDS Network England. I think we're actually at a kind of big period of change at the moment. Over the last 3 or 4 years, Citizen Network has been running a program called It's Our Community, which has been a learning program to think about what the real future of social care should look like. And without a doubt, the overwhelming theme of challenge and desire has been to get things much, much more local. And that's what I mean by a neighbourhood in this context. Obviously, in a rural context, that could be something quite different, like a village or a hamlet. But in an urban context, neighbourhood is probably the right kind of word for us. Why are we having this conversation? Maybe we should have always been talking about this. And in many countries, the kind of centralisation of social care that we've got used to in England didn't really take place. So we've gone further, I would argue, in the wrong direction in many places. But there has been a general global trend to centralise, to regulate. But what we've seen, I think, at the moment, and why this change is starting to emerge, is obviously the public spending crisis. We've had 14 years of austerity, and even with the prospect of a change of government, nobody's really expecting any fundamental change to public finances. But we've got a kind of crisis in the model of regulation and control. Well, I was going to say sadly, it's not sad. I'm 59 years old, but my whole career has been during the time that's been dominated by the kind of the purchaser provider split, the NHS Procurement Act, or NHS and Community Care Act of 1992. The kind of model, when I was learning about these things, I was at the King's Fund in 1989, 88, 89, and those people were actually leading this change in thinking that they saw as a good thing. This split between purchasers, providers, this drawing up of power into commissioning arrangements that would be rational, logical, would drive forward innovation, the use of markets for public good. And as I said to the academics I was talking to yesterday, you know, if you now ask the question, well, where's the evidence any of this worked? You can't find any. There is no evidence that the contracting mechanisms that really dominated public service delivery from the kind of early 90s onwards have delivered the changes that were promised, or even delivered the efficiencies that they're meant to deliver. And we've got other problems as well. I mean, there's a severe problem of morale in public services. Many doctors, for instance, we recently published a paper by some very senior consultants actually arguing to the Labour Party that the Labour Party needed to embrace community much more, that doctors did not want to be operating in bigger and bigger bureaucracies. So if that's true for doctors who are perhaps in a kind of peak profession, how true it is for social workers, for district nurses, that so often they're working in systems that are actually taking them away from relationships with ordinary people. Then we have a huge problem that's increasingly being drawn attention to by the United Nations, pointing out that the care system is basically deeply unfair to women. That what we're in a situation where unpaid care is the normal form of care, and it's normally provided by women, and paid care is normally provided by women, and usually at the bottom of the pay scale of the economy. And then when you add in the pressures we create for those women, whether they're working or unpaid, by care systems that are very distant from their neighbourhoods, from their communities, from their families, we further the stresses and strains on people. But more positively, we've seen all sorts of really good things emerge. We've seen peer support emerge. We've seen the example of Keyring, which is a kind of early model of organised peer support that's been so effective. We saw the COVID crisis and mutual aid that emerged in neighbourhoods.
Thanks for that, mate. Cheers.
Hi there.
Cheers.
And we've seen increasing efforts to organise more kind of democratic reform at a neighbourhood level. And I think at a deeper level, people are starting to recognise that the kind of mechanical approach to society that we see in so much of the kind of public policy thinking and the consumerist approach is now out of date. So the people are becoming more sensitive to the idea that we need to grow ecosystems, that we need to think in terms of regeneration. And crudely, I think we're entering a kind of the end of a 40-year cycle of public policy. So in a sense, quite often what happens is that ideas just run out of steam. And I think the ideas that have dominated public policy have run out of steam. This is a map. The data reflects just my city of Sheffield, but similar data could be in different places. We developed this during COVID to kind of help communities think about how they self-organise to respond to the crisis. I won't go through it in detail. The point is that the crisis showed both the capacity of neighbourhoods, but also the need to think very, very differently about neighbourhoods, to organise very differently. And I think that's going to be one of the central themes of the kind of next few years as we think about this. At a deeper level, you can think about this as rethinking what's at stake in institutionalisation. What drives institutionalisation? In a sense, institutions are the response to a crisis that's emerged out of the failures at higher levels, further uphill. That, you know, the reason people are in services is really because of failures further uphill, and the fact that then some of those services start to eject people and send people into institutional environments is a function of their failure. But beyond that, we've got to think about the citizens and what citizen responsibilities exist, what family structures exist, what community structures exist, what are the underlying systems of social justice. I mean, at the moment, one of the major drivers for kids going into care is extreme poverty in the UK. Families under immense stress, often both parents working, and then being found to be deemed to be incapable parents, and their children going into private residential care. And all of this sits on top of the kind of natural question of our relationship with nature and the disharmony of that currently exists. So all of these things start to drive the changes we see. So the assumption that certainly me and others have been trying to pursue, the kind of basic hypothesis, is that the neighbourhood should be a central function of future policy thinking and action, actually across many fronts, not just care. But care is an area where the value of neighbourhoods could be so much greater than it currently is. And this is a model I use to try and help people think about this. It's a kind of more organic model. If you do think about a functioning community as something that actually enables people to step up into citizenship, supports people, welcomes people, gives people opportunities, then the neighbourhood is the kind of best starting place. It doesn't mean that neighbourhoods are the only things we need. So this slide is also trying to draw attention to the kind of bedrocks that sit underneath the neighbourhood. So we do still need businesses, voluntary sector, different organisations, what we call civil society. We need community services, we need general practice, we need social work, local area coordinators, other forms of organised service at a community level. We need good public services. We're not going to organise brain surgery at a neighbourhood level. We need good local government. We need much greater attention, I would argue, to social and economic justice. And we need a kind of constitutional settlement upon which all this sits. I know I'm covering a lot of ground very quickly here, but really I just want to get this sense that we're not talking about a kind of simplistic choice of only this, some kind of primitive, strip everything away and go back to neighbourhoods, everything will be all right. No, that's not true. But what we've tended to do is really ignore the neighbourhood in public policy making. In Sheffield, and Mary will know this very well, Sheffield people know that they live in a neighbourhood. Most people can name the neighbourhood they live in. and those names are pretty consistent. But there's no actual acknowledgement at the moment of the existence of these neighbourhoods in the civic structures of Sheffield. And so we just completed a citizen-led mapping of neighbourhoods in Sheffield. And this is, I think, is quite exciting. We've now identified a map of 147 different neighbourhoods in Sheffield. And the reason we're doing that is to actually, not just for the sake of having a map of the neighbourhoods, but it's to start getting people in Sheffield organising differently on many different dimensions, working in greater harmony and partnership with statutory services and the council to bring about the social changes we need. This very complicated picture, which I'm going to jump into little elements of it, is my way of trying to think about how do we start to make the changes we need to make. So I apologize for this complex picture. I'm always trying to find a simpler way of doing things, but sometimes you have to start with the complexity that you need and then work from there. And this is based around the Citizen Network Agora. So Citizen Network thinks about how we can promote people as citizens, and the Agora was the structure, actually sacred public space in Greek cities, particularly Athens, where lots of different things happened. It's quite interesting. In English, we often translate the word agora into a market, and the agora certainly contained a market. So it did include a place where people bought things and sold things, and that's represented in the kind of bottom quadrant of this. So the ancient agora included the market, but it wasn't the biggest thing in the space of the agora. And importantly, nobody could buy any of the land in the agora. So what the Athenians understood is it's really important for citizens to have shared public space where they could meet, connect, and organise. And so that's what an agora is. And I'll jump through some of these things, but one of the interesting things that happens if you think about neighbourhoods is it changes the scale of lots of things. So I think that number might be slightly wrong when I was working with a slightly lower number of neighbourhoods than we've got, Mary, but let's say 4,000 is kind of quite a standard in the people like Cormac Russell who work in the field of community development would say a good size for a neighbourhood from the evidence we've got is about 4,000 people. And if about 3% of the population are entitled to social care, that means that out of those 4,000 or so people, there's about 125 people who've got significant social care needs. Now, that's not to forget that there might be people with other significant health needs who that figure doesn't include. But the other thing we know from the work that we've done with Barnsley and Doncaster is that if the community actually itself was organised to provide peer support, it in equivalency terms would be producing about £10 million worth of peer support. This is one of the things that is really missing from our understanding of social care, is the value of all the things that people do, not just carers doing, but neighbours and citizens supporting each other. So that's the kind of basic dimensions. And obviously one of the things that really would stand out for many of you, I think, is that if you've got 125 people in a neighbourhood, then it may be much harder to start thinking about everybody in their silos. You know, how many, there will be, a few of those people will be people with learning disabilities. A few of those people will be people with physical disabilities. Quite a lot of those people, but not half of them, I would reckon, this is including children as well, would be older people. And then there'll be children and families and people with chronic illness and people with mental health problems inside what's really quite a modest number of people. So that raises questions about whether actually, as we start to move towards neighbourhood care, do we start to think differently about disability? Do we start to move away from professional definitions of the differences between people in some way? Not abandoning them, maybe. I'm not sure that would be good, but certainly thinking differently about what role they play. Obviously, it's really important to pay attention to the values that we apply to any change. So these values reflect the values of Citizen Network, and they're about inclusion and they're about citizenship. But they're also talking about everyone having a gift. I think one of the key things that we have to remember in this kind of work is that it's about recognizing capacity in everyone. And it's also about recognizing a principle that we shouldn't be, as a neighbourhood, exporting people. And by that, I mean the actual standard practice at the moment, if we think about it, most social care funding is spent on residential care outside people's own neighbourhoods. So that means that the primary action of social care is actually to currently export people from their neighbourhoods and to export the money that would have been spent in that neighbourhood on those people to somewhere else. And as we know, often that's also private businesses, some of whom have bank accounts in the Caribbean. So in terms of regenerative practice, what we're doing is actually stripping money away. The precious little money we have for social care, a lot of it is kind of leaving the local economy rather than supporting the local economy. This way of thinking also is linked to getting the different ideas about how democracy can work and how people start to organise. One of the most inspiring things I've learnt about over the last few years are the neighbourhood parliaments in southern India. These neighbourhood parliaments include millions of people, literally. And when we talk about a neighbourhood parliament, they're talking about everybody in a community. And I mean everybody, children, young people, adults, all having roles in their community life. So you would have, like, children would have kind of a ministry of fun, and they'd appoint one of their peers to lead on organising activities in the street. The families would end up taking on leadership around different roles around at a street level, and then at a kind of neighbourhood and village level, and then federating upwards. I know this feels like very distant from the reality we're in. But actually, we started to see some of these kind of patterns emerge during COVID, and they're patterns that we can encourage, that enable people to see that they are valued. Often what people struggle with is they're not confident that they have a role to play in the community. So actually, in a way, democracy isn't, as much as anything, is about saying everybody does have a valuable role to play, and we'll create the roles that we need so that we can take care of each other and take care of the community we live in.